Hi, in this video, I'm going to be talking about immunotherapies for the treatment of breast cancer. We talk a lot about the immune system in breast cancer. We talk about keeping your immune system strong when you're getting chemotherapy. Our immune system is so beautiful and elaborate. I think of it like an enormous maple tree with lots of different branches. So the white cells that help kill bacteria that get lowered during chemotherapy are neutrophils. And that's like a small branch, maybe a branch of the maple tree you might hang a bird feeder on, not a swing. It's such a small part of the immune system. Then there's the T cells, which are important in keeping cancer cells suppressed. And a lot of therapies that we use in the treatment of cancer that are called immunotherapies work by sort of messing around with anything that inhibits those T cells from working. Immunotherapy in breast cancer is not given to everybody. It's based on whether or not the tumor cells have a particular marker. So you may have heard of PD-L1 inhibitors or PD-1 inhibitors. These are used in the treatment of many cancers, not just breast cancer. But in the treatment of breast cancer, these drugs, and I'm thinking particularly of pembrolizumab, which we'll have on the screen. The brand name is Keytruda. This is a drug that's been heavily marketed for many different cancers. This is used for the treatment of people with stages 1 and 2 breast cancer, either before or after surgery. So this is an advance in the world of breast cancer, or in people with advanced disease, where the disease has spread. Again, this is not in every single person. The tumor cells have to have a particular marker. Immunotherapies are generally given along with chemotherapy. They're generally not given alone. So it's not an alternative to chemotherapy or, in some people, targeted therapy like trastuzumab or pertuzumab. Anything ending with an MAB is a monoclonal antibody. So that sounds like an immune therapy too, right? It's an antibody therapy. And when you read about immunotherapy for breast cancer, sometimes those targeted therapies get included because it's a type of antibody. But we want to be really precise, and we think about the immune checkpoint inhibitors, like pembrolizumab, as an immunotherapy, again, given with chemotherapy. I'm covering a lot. If you want to learn more about treatment options available to you, go to Yerbba.com to learn more. What I'm going to do now is talk about some of the side effects of immunotherapy. It's important to know that these drugs are pretty new, and we have guidelines on how to manage the common and uncommon side effects of immunotherapy. But it's important to know that these are serious medications and that staying in close touch with your medical team, especially your oncology team, is really important if you're on immunotherapy. The way I like to think about the side effects is that they're generally inflammatory. So things that end in itis. So hepatitis, which is inflammation of the liver, or colitis, which is inflammation of the colon, are two very common side effects, and in fact can be severe enough that people get hospitalized with these medications due to these side effects. There's really no part of the body for which we haven't seen inflammation, including the eye, including the thyroid, including the lungs. So if you have side effects, and you'll get education about the side effects that can occur and when to call your medical team if you're on immunotherapy. I promise you won't just be put on the medication and then sent home. The real message I want to deliver is that you should take side effects very seriously, because we have ways of treating these side effects and preventing major organ damage. Not trying to scare you. It's always good to see new treatments in any cancer, and breast cancer in particular, if you're watching this video. But it is important to know this isn't just boosting your immune system through a healthy diet. This is really harnessing the immune system in combination, in general, with chemotherapy to do as much as possible to kill the cancer and suppress the cancer, but we don't want to hurt you, the host. I've covered a lot in this video, and we will list in the accompanying text some of the side effects to look out for. We'll also have a blog post about this, but really your medical team is going to be the source of information because each of these medications can have different side effects. Again, visit Yerbba.com if you want to know if these might be part of your treatment plan. And if this video has been helpful to you, click like and consider subscribing to our channel, because what that does is it helps other people who have the same questions find this video more easily. Thanks for watching.